Sound check 1 2 3. Sound check 1 2 3.
Good morning and welcome to the Board of Health for September 8th, 2025. I'm your chair, Ward 2 City Councillor Cameron Cretch, and joining me here are members Chelsea Kirkby, Emil Joseph, Councillor Mark Tennyson, Councillor Tammy Huang, Councillor Craig Kassar, Councillor Alex Wilson, and member Andrew Chung, and online joining me virtually, Councillor Ndernan and member Don Danko. Thanks for being here. We have quorum, so I'm going to call this morning's meeting to order. First thing we're going to do, approve the agenda. May I please have a mover and seconder to approve the agenda for today? Moved by Councillor Taddison, seconded by Councillor Huang. Any pressing issues about the agenda, changes, thoughts, comments? Member Joseph. Vice Chair Joseph.
I apologize for my absence, sending my regrets for the last meeting. I did receive an email update and read of reports of the incident that occurred. A hateful diatribe that included racist, homophobic, anti-trans language, and I see that it was omitted, probably intentionally, from the online video, also not mentioned anywhere here. I wanted to mention it because I did receive an email about it, and I read about it as well. And I just want to acknowledge for the councillors and members and members of the public, people of Hamilton, that, you know, how hurtful that kind of thing is. And we have health equity inside of our mandate here as a board. And the ways hateful ideas influence public opinion and shape people's thinking around health policy and practice counts in relation to, you know, those kinds of hateful discourses, which are flourishing in Hamilton. And I don't think an omission of any incident or occurrence that tries to advance such should be go unchecked or unnamed. So I just wanted to say to everyone here and those impacted that I'm sorry that happened. And I hope to attend to these things as I do, and that we could do something fruitful together in response to the rising hate in Hamilton.
Thanks, Vice Chair Joseph. Just so you know, on the day of the event, I made sure I said some of the same things you said. I stopped the meeting, asked the person to leave, and then after that, we made sure that the clerk sent an email to everybody, making sure that they knew what resources we have to help address this and knew what the city was doing. You'll notice today, for instance, we have an increased security presence at City Hall for public meetings, and so we have folks in the chamber, folks outside the chamber in light of that incident. So we are taking it more seriously, which is good. I will say probably your comments should have been saved for the minutes approval. And when they come to the minutes approval, if you want us to add something in there that just acknowledges that there was a hate incident or that something occurred here, although it was not officially part of the agenda for the meeting, I imagine, and I've seen it before, other notes in minutes. Maybe we can add a note to the minutes so it's there for the permanent record so people know when it happened and know what was there. And the city clerk's office can choose what language makes sense, but noting it is a good idea. So when we come to the minutes, I'll come to you. Any other questions on the agenda for today? Not seeing any. All those in favor by show of hands on the agenda. Great, the agenda has been adopted. I'll say one thing very briefly now that the meeting is going, just so people know that two things. One, the HPPA, the act that governs some of the work that we do, says that we have to elect a vice chair and a chair every year. So just so you know, in January of next year, we'll elect a vice chair and a chair again. Secondly, people around this horseshoe and the public have asked when we're going to be replacing the seat that now MPP Robin Lennox holds, and how we're going to replace that vacant seat. And so briefly to let you know, the selection committee has met, conducted interviews, and we'll be bringing a recommendation to City Council on September 17th to fill the seat. So we took action on that, and we have a recommendation for Council to fill the seat. And once Council approves that recommendation, then we'll have a new member joining us at our October meeting. On that, we'll go on to declarations of interest. Are there any? I'm not seeing any declarations of any conflicts of interest, so we'll move on to number 5 on our agenda. The approval of the minutes of our previous meeting. I'll need a mover and seconder to do that. Moved by Councillor Huang, seconded by Councillor Tattison. And we'll now entertain the amendment here from Member Joseph. I don't think we need to actually formally ask for an amendment to be made. I think as long as I can look around and no one else minds if we add that, then we can. I'm not seeing anyone objecting. So we'll have that added to the minutes officially, maybe right at the top, just to say there was something that happened at this meeting and what that was and get a description. And maybe if it's okay, I could hear from the legislative coordinator on this.
Yes, through the chair, but the city clerk is joining us online, and maybe he'd like to make a note about adding a note to a minute.
Thank you. So we're just going to wait for the city clerk who's joining us here.
Morning, Chair. Just confirming you can hear me?
Yes.
Perfect. Sorry, my internet is not great at the moment, but so generally we create our minutes without note or comment. If it is the desire of the committee to add something with regards to sort of the incidents, we could ensure that something appropriate is added.
Okay, thank you. I know that we've also done in the past when we have, for instance, no quorum at a meeting, we create a kind of minutes report. So I leave it to you, like whatever you think is the best way of doing it. But I would say if it's okay, maybe we can bring that back to the next meeting. So we can bring the amended minutes back to the next meeting just so everyone can see it in case there's anything anybody wanted to do about that or change or there's language or whatever, if that's okay. Would it be all right to just bring both those sets of minutes to the next meeting, or is that going to encumber us in any way?
No, we can manage that, Chair. If you refer it back to us, we'll bring it back with what we believe to be appropriate language.
Okay, so would someone motion that we refer the minutes back and then we have them come back at our next meeting? Need a mover and seconder for that. Councillor Alex Wilson, Councillor Huang. And so we'll do a show of hands votes to refer the minutes back with those changes. All in favor or opposed? That's everybody. We'll do that. On to items for information. First one is 7.1 BOH 25020, the City of Hamilton's Public Health Services Service Level Agreement Overview. Lots of services in there. Need a mover and seconder to put this report on the floor. Moved by Councillor Huang, seconded by Member Danko. Is there any discussion about this item for information? I'll briefly just say, if those who don't know, it's something that we've done many times before, and it's just our service level agreement with the City of Hamilton for the services they provide, human resources, IT, whatever it might be. We have to have this here for the Board of Health. And as a note, this is exposed in a more financial detail through the budget process itself. And I've asked actually if we can have a little more financial detail in the future when it comes back so that we can see how much each one of these line items costs. So we have a better sense of not just what the overall cost is for the services we're procuring from the city, but also what those are line by line. Not seeing questions, so we'll take a vote on those in favor to receive. All those in favor, show of hands. That's everybody. On to 7.2, BOH 25022, Budget Orientation and Public Health Services 2026 Budget Outlook. Dr. Richardson, our Medical Officer of Health, is here to provide the committee with a presentation on this item. And once the presentation is done, I'll get a mover and seconder to receive the presentation and report. But first we'll hear from Dr. Richardson.
Good morning, everybody. So we've got a budget orientation and outlook that we're providing for you today. So it's not your full budget. It's just the beginning of moving through the process. You'll recall that that we've talked about this a little bit before, but because we haven't really gotten in detail on budget, we wanted to take a few minutes and sort of step back. It's a fairly dense presentation. It's probably about 20 minutes in total long. I'm going to try and bring that down to 15, but I tried it last night. That we're just trying to give you the information that you need, and so any feedback in terms of whether it's meeting the mark would be appreciated as well. So thank you. Jessica's got that up there for us to move through, and I'll just go to the next slide. So during this presentation, we're going to go through the roles and responsibilities for both the Board of Health and the City Council under the new semi-autonomous governance model. I'm going to go through the funding sources and structure to support service delivery. It's a bit complex, so we're going to give you an overview of that complexity and look at the budget pressures that we're currently experiencing and share the guiding principles that we've used in developing the budget, because we've been at this since May, and present finally the budget outlook itself. That's when we'll get some numbers as well as the key cost drivers, and then look at the next steps and timelines. So next slide. You'll remember that the Association of Local Public Health Agencies, the executive director and one of the training staff came and presented on, what to expect as a Board of Health, bringing the collective experience from boards across Ontario. And so one of the things that they outline in their materials for governors are this summary of roles and responsibilities that are pertinent to this topic. So being informed of community needs and changing trends, which a lot of that's in our community health status report, for example, and of course the collective wisdom and experience of people who are around the table. Being aware of local resources, so that's not just the public health resources, but what other resources are there out there in the community. Understanding the financial position of the health unit, so we've been trying to layer in some of that information. You have a budget variance report here today as well. Of course, we've been a little hampered by the Build Back Better initiative post-cybersecurity incident, and so there's not been quite as much financial information as you would have had otherwise, but we continue to build on that and bring forward what we can. And then ensuring ultimately responsible and adequate spending of the financial resources that we have. So both the city and the board have legislative requirements when it comes to funding and budgets. So these are found in the Health Protection and Promotion Act. They're found in the City of Hamilton Act, which of course was revised with the setting up of this semi-autonomous board. They're found in the Municipal Act because the Board of Health is by and large considered one of the local boards under that act, and that act lays out financial responsibilities. And then of course the Ontario Public Health Standards have a number of responsibilities as well. So under the Health Protection and Promotion Act, the full responsibility for paying public health services expenses falls to the municipality. And then it allows for the provision of grants by the province, but without that legal obligation within it. So I'm seeing a bit of a quizzical look. I'm wondering if we've talked about when's best to answer questions, and we said we'd inquire as we went through to see if there's something in particular, but if not, I'll just carry on. Okay. So, ultimately it's clear that collaboration, of course, between the city and the board is really essential when it comes to carrying out these responsibilities. So I'm going to get to that piece, if you can go to the next slide, about numbers and trends in a little bit, but I'm going to continue to look at our funding structure, because we're not just one organization, funded by the province and the municipality for one set of services, and Bob's your uncle. We have multiple programs and services governed by multiple funders, and they all have different rules, different regulations, accountability, timing, in terms of what it is that they want to have done in relation to those programs. Most of our base-funded provincially mandated programs under the Ontario Public Health Standards are funded through a cost-shared model. So we've talked about this a little bit over time, and that split is set out by policy with the province in terms of how much they'll contribute. And currently, they're contributing about 64% of the dollars for this, while 36% are coming from the municipality. That does not include the Ontario Seniors Dental Care Program and other one-time initiatives like the COVID and RSV vaccine programs, like public health inspector practicums, that they fund 100% through their funding. In addition, we have a number of services that are supplementary funded programs. So these are basically services that have been set up usually by a single level of government and were designed to be funded by them. So we have programs with 100% federal funding. So there's the Canadian Prenatal Nutrition Program, for example, that we have run for many, many years. We also get some one-time funding or grant funding, and so we currently have a grant to provide the Vaccine Ambassador program from the federal level. We also have programs that were designed to be entirely funded by the province, and so those are things like child and adolescent services, Healthy Babies, Healthy Children, the Mental Health and Street Outreach Program, the Alcohol, Drugs, and Gambling Services group of programs. And you'll see an asterisk there about the funding for those, because in each of those cases, The funding over time has not kept pace with what's required to maintain service levels in those. And you'll know that needs have been growing in those. And so the city has over time chosen to continue to maintain service levels, but by providing extra dollars to support those programs. And so, that's particularly been so with those that are targeting children, because being the best place to raise a child has long been, and to age successfully has been the mission and the vision of the city. And so those were particularly invested in over time. And then we have some 100% municipally funded programs, so things that are entirely paid for by the municipality. So we have an adult dental treatment program, for example, that provides dental treatment for low-income adults. And we have residential care facility inspections, for example, and a number of other smaller programs that the municipality chooses to fund. So next slide, please. So when you try to put it all together as a single graph for the whole of public health services, it's taking all of those bits with this slide. It's not breaking them out. When we come to present the budget a little later on, we'll give you more detail around it, but right now we're just giving you a sense of the budget in whole. And so this particular graph looks at historically in the last 5 years, what have trends been like in terms of where those funding sources are coming from. And of course, this takes in the 5 years, over the last 5 years, this takes in the whole of the pandemic, when the focus has really been on responding to those issues. And so you see the blue line, which is the top line, represents provincial funding. And you'll see that it peaks in 2022 as both the disease control and vaccination programs were well underway. You'll see then the green, I was trying to decide what to call it because there's kind of two green lines up there. The teal line is the next line down. That's the municipal funding and what's happened with municipal funding over time. And you'll see that it's been increasing as well to make up for some of those shortfalls as the province has turned back to other priorities post-pandemic. You'll see that line has been increasing over the last several years. And then you'll see a sort of mishmash of what's meant to be some green and red, and I think there's a purplish line in there. And those are the other smaller funding sources. So we do have some user fees for things like food premise inspections, residential care facility inspections actually are also funded in that way. And several other programs and services do have some user fees associated with them. They're in those three lines. There is small amounts of provincial grants that we receive for the programs I already outlined. And then over time, there's been some small amounts in certain years that have come from reserves. And so public health services generally doesn't have any sort of significant reserve. Occasionally we run a program, usually for the feds, and if there's any funds left over at the end of that program, we're able to keep those and put those into a reserve. And we generally use those then in subsequent years for emergency response. So you can see during COVID, they were applied as needed to help defray costs for the municipality around emergency response. And then there was a policy decision made last year by council to continue to use any reserves that were available in order to defray costs. And so that's why you see about 700,000 used in 2024. So we know at the same time as all of this has been going on, we've had significant pressures around things like catching up on childhood immunizations, which we're just in the process of getting through at this point. And there have been other needs like child and adolescent adult mental health, and as well substance use and those sorts of things. And so this is some of the funding increases that you see on the municipal level have again been deliberately investing to provide additional services as well as maintain services in those areas. So I'll go next to the forecasting slide. So this next one looks at where are things expected to go over the next 4 years. So again, we do our projections based on maintaining current service levels. And so no increases in programming are anticipated here. We use city assumptions around wage increases, benefit increases, and all those sorts of things in order to estimate future costs. You'll recall that the ministry had decided to provide 1% per year in increased funding per year since the beginning of 2022, and that will end in 2026, so that 1% increase is included here. And then beyond that, for the Ontario Public Health Standards programs, it's been assumed that there's a 0% increase. You see that flatlined. For the other supplementary programs, we don't know until we're in the midst of doing budgets with them what they're going to do in any given year. And so sometimes they get a funding increase, many times they don't, they're just flatlined. And so we just make the assumption of a 0% increase. Just want to remind you as well, the province is revisiting their funding approach for local public health. We're told now that we should expect having something from them in 2026 for implementation in 27. So we don't have any ideas yet as to what that's going to look like. So that's not taken into account here as well. So if all of those assumptions were to come to pass and existing service levels were to be maintained, you can see that the provincial lines are flatlined. And if the municipality were to make up that, the difference in costs, there would be an increase from $17.8 million in this year to $23.4 million by 2029. Next slide, please. So now I'm going to turn to the actual development of the 2026 budget. So this slide outlines the various pressures from a service perspective that we're grappling with as we pull together the budget for 2026. And then, of course, we operate in a policy environment, and so we have some policy changes that we're anticipating. So on the service side, we've already talked a fair bit about the fact that the funding grants aren't keeping pace with inflation year over year, whether it's wages, benefits as well. It's just not keeping up with the increases that are happening. There have been also rising costs associated with population growth and increased service demands. And we're seeing more complex population health needs, which drive up costs. So I'll give you an example from the communicable disease world again. So on the TB front, we now have more TB cases than we've had historically. It's been rising over the last several years. Some of this is due to immigration and people coming from countries with higher incidence of TB. So they're arriving and developing TB disease after they have come here. Some of it is related to homelessness as well. And these cases tend to be more complex in both managing the case themselves and managing the contacts that are involved in those cases. And so that leads to increased costs for our infectious disease program. Of course, you all know about the outbreak of measles we've experienced in Ontario this past year. And so we've had some cases of measles here. We've been fortunate, not many, but they're being reported, suspect cases are being reported much more frequently, which is good. We want that to happen. But of course, every one of those takes staff time to investigate, look into, and decide, how far it needs to go. And when they are truly measles, they can have 100 contacts because measles is so infectious to follow up. And they require impromptu vaccine clinics to be set up within about 24 to 48 hours for those who are exposed and not vaccinated. And that's required in order to stem the tide of the spread of measles. We also have evolving mandates coming from our funders. And, most recently we've seen things like the new COVID and RSV vaccine rollouts. And often we're receiving notification of these at very short date to implement quickly. And so we need to be able to respond to that. And so we've had some flexible staffing solutions that we've been putting in place in order to do that. And I'll speak more about that in a moment. And ultimately, our mandates do evolve. And I just want to tell a little bit of a story, for example, about Smoke-Free Ontario, because this is one that really shows what we deal with year over year in time. And so if we go back to 2007, there was a huge investment in the Smoke-Free Ontario Act and its enforcement and in tobacco control more generally. And of course, very much justified, significant cause of disease and disability for Ontarians and here in Hamilton. And a lot of the focus was on youth tobacco use prevention, which was fantastic. Stop it before it starts. And we were one of several regional tobacco control area networks that were set up across the province. But over time, the ministry started to call back funding for youth tobacco use prevention. And ultimately, they flowed 100% dollars and then changed these to cost-shared dollars. And so the municipality had to pick up a share of that programming. And then they continued to amend the Smoke-Free Ontario Act and add additional areas for enforcement. And we had, for example, expanded enforcement for vapor products. Again, something we would all agree with in terms of it moving forward. But there were no increases in funding that came along with that. And so what the province told us to do was to prioritize and figure out how to accommodate it all within our existing budget. So these are the sorts of things that we grapple with over time with the mandates that were given. Another piece for us has been public expectations for transparency and accountability, something we completely agree with and want to do. But it does require more time, more communication and engagement to better meet people's needs, to better ensure understanding and to ensure our programs are really well-based and effective. We're also in an age of digital transformations, so we see this, of course, day to day, but, and the city, of course, has its substantive investments in this area. But again, modernizing digital applications, whether it's a new electronic medical record that is being introduced, for example, has happened this year for our alcohol, drug, and gambling services, or digital tools, as we need to do to display data on the web. It requires dedicated resources to do those sorts of things. So finally, the policy changes, I've already mentioned about the new Ontario Public Health Standards and that they're going to come into effect in January. We have seen a draft in May of 2025, not seen anything, sorry, May of 2024, and haven't seen anything since that time. And so we can't guess at what it will be. We do expect it'll bring things up to date, which is great. But we're not expecting any new funding if there's expansion of mandates or that sort of thing. So we'll be working over the next several months as we're hoping that information will come out, because they've told us to expect implementation in 2026, so that we can respond to those changes. And of course, this transition itself has added some small amounts of work and cost in terms of the semi-autonomous board, and so those have been taken up within this budget and budget process as well. So next slide. So based on all of these things, we, as I said, have begun planning in May, the public health leadership team and all of our management staff. And so they're looking at a number of things in order to maintain service stability and address the needs of priority populations and make trade-offs, quite frankly, and looking at things and prioritizing and what do we need and how are things evolving, how can we continuously improve, make trade-offs within the budget. So the approach has been involved balancing our core mandates with local population health needs and evolving direction. We continuously work to strengthen program efficiency through continuous quality improvement mechanisms and working with other partners, as well as looking at other granting sources, quite frankly, as you'll see, for example, with the Vaccine Ambassador Program and the Public Health Agency of Canada's funding there. Our focus is around preserving our essential service and improving population health outcomes for our priority populations, and then strategically allocating and in some cases reallocating resources to minimize the impacts on both the service levels and on staff. So key tactics that we have used to date include things like the flexible staffing models that we've put in place. So we've done what I think is some remarkable work, and our staff have been incredible in terms of moving this forward. A lot of what we saw as we came out of the pandemic was agencies, local public health agencies, needing to divest from areas in significant amounts in order to put more into communicable disease control. And we had to do that to some extent. However, we looked at it, and often in those communicable disease control pieces, it's episodic work. Whether it is a measles outbreak that we're responding to, or it is a new vaccine that they need us to do some part of for some period of time. And so we don't really want to completely divest in one area and then invest at a level that responds to those peaks rather than sort of an averages sort of piece. So we worked with our nursing staff to look at implementing what we call the Immunization and Infectious Disease Competency and Capacity Initiative. So all of our nursing staff, and this it stands as well for emergency response as well, they maintain competence in immunization and infectious disease case and contact management. So if their day-to-day work is harm reduction on the street, they do some work during the year in these areas so they can stay able to do it. If it's health promotion that they're doing out in the community or Healthy Babies, Healthy Children, they participate in this program. Every nurse does, so that they can be prepared and able to do that kind of work. So it's really allowed us to maintain service levels in those areas while we do still provide for those peaks and flows that happen in communicable disease and vaccination programs. It also means that our nurses feel quite confident when they're called on to do that work, rather than feeling like, oh my goodness, fish out of water, I thought I was here to do something else, how do I do this sort of piece? We've designed the program so that they stay competent and have experience every year. So we also do things like recruiting over complement. So we have permanent over complement positions in our high demand areas. So you say, but doesn't that drive up costs beyond what's budgeted? But essentially, these are areas that have a fair amount of turnover as well. And so by doing this in our areas where we have that, it promotes both people staying, because instead of getting a temporary contract, they get a permanent one. Attracts higher quality candidates, because again, instead of getting a temporary contract, they're getting a permanent one. And we also do still extend our temporary contracts where we need them as well. And then finally, we continue to prioritize and drive forward those continuous improvement initiatives to look for efficiencies and better service as we go. So we're finally getting on the next slide to numbers. And so if you look forward for 2026, you'll see based on the multi-year operating budget for 2025 to 27 that was presented in 2025, for the 25 budget, you'll see that the projection is for a gross budget of 64.54 million, which is 1.44 million or 2.2% higher than the gross budget in 2025. So we're continuing to work on this budget as we go and look at what further refinements can be made. But I can tell you that we're within this projection. We're not over that projection. That ultimately for the city, if they're to pick up their share of that 64.54 million, it would mean a net levy increase of 19.07 million or 7.1%. So that is for the reasons that we've talked about before and the projections that we've made. So staff continue, I think, again, this is for a maintenance budget. This is not with any expansion in services. So staff continue to work on this budget now, and I'll come to the timeline in a few minutes and look at and see whether those amounts can be reduced through any other efficiencies or those sorts of initiatives. So our key cost drivers, not unexpectedly, are employee-related expenditures. We deliver services through people, through dentists, nurses, health promotion specialists, inspectors, social workers, and those costs make up more than 80% of our expenditures. The next driver is our building and materials costs, so things like rent and other things that are affected by inflation. And then finally, the cost allocations, which is essentially the cost for those service levels that we were talking about in the previous item, the cost allocations from other city departments and who provide support and administrative services for public health. So you'll get more detail on all of that soon, according to the timeline. So we've been working with our colleagues in finance, and you'll see Brian McMullen is here, who is one of the directors. And we've been working with Brian and his colleague Kirk, who is another director who works on the budget process, to align really the process for the city with this new process for the board. And so, as I mentioned earlier, this board is a local board under the Municipal Act. So it fits into the board process that the city has. And that process is the same for the Hamilton Police Services and for the Library Board, for example. And so this budget will follow that same process. So first, staff are going to come back to you on October the 20th with a more detailed preliminary budget. At the meeting on October 20th, we'll get as much information that we can gather from the city process by the time we bring it there. However, there may be some more adjustments, particularly looking for the mayor's direction to come out. And so we will bring any of those adjustments then to the November 10th meeting for final consideration and approval of the 2026 budget. Following that, the board then sends the budget to the city for consideration of the levy portion. And so that timing has been set so that the board's approved numbers can be included in the December 12th release of the city budget by city staff so that they can have as complete a budget as possible before them to consider. And then ultimately the public health budget will be presented to the General Issues Committee during the boards and agencies presentations. Those happen at the end of January is the current schedule. And then finally, the council will approve the final 2026 levy budget in late February or early March and communicate their decision back to the board. Subsequent to that process, then there's all the other pieces that relate to all the other funders that go on. And so we take the different portions of the budget and submit them through into the budget processes of the province and the various ministries that we work with on that, as well as the federal government, where we have programs with them. Last slide, just so hopefully you found that helpful. I know sometimes when you haven't got more details in front of you, it's just a teaser in some ways of saying, okay, great, now like what does this really look like? But wanted to make sure we'd given you that background before we dived into the budget per se, so that you had some understanding when you see that greater that detail, and particularly the pieces around the complexity around the funding and where it comes from and the responsibilities. So it's really important to have you engaged in the process, of course, because ultimately that's how we ensure that it's responsive to our community and provides, again, the best value for services that we can. So that's it from me. Happy to take any questions.
Thanks very much, Dr. Richardson. And first up on our speakers, this is Councillor Huang.
Thank you. Through you, Chair, just to Dr. Richardson. I understand that this is merely an overview, but I wonder if you can give us a little more indication as to how behind the scenes your staff and your team are actually looking at how would you enable staff vacancies, how does that get built into this budget? What about potential programs that may or may not get canceled? Or like, I think just also giving us a little insight into the background and how your teams kind of come together and take a look at the fulsome inventory of programs, and also like looking at it from a staff sort of staffing levels, and then seeing how that might impact what this budget looks like as well.
Sure, absolutely. So for our programs and services, with all these different funders and mandates, we have different expectations. And so those, of course, are, continuously under review, and we have plans for every one of our programs that are sent into the relevant funders, and we monitor those over time. You saw some of the performance data that we use for monitoring. We're have good relationships with those funders and in constant dialogue with them, and pushing for any changes to come in a timely way so that we're not surprised by them at the last moment. And so that work continues on. And as those new public health standards, for example, come out, there'll be a further process of looking at those and seeing what the implications are. And if there were any implications from those, we would bring that back as part of the annual service plan piece. So that monitoring happens on a regular basis in terms of performance, looking at what the standards are, comparing how we're doing to plan, and then looking at how we might plan for the coming year. And we actually do a multi-year budget. We're required to put forward budgets on an annual basis by most of our funders, but it's not adequate. The issues that we're dealing with are not sort of annual issues. They're long-going ongoing, longstanding issues that we're looking to address. And so we put together multi-year budgets that look at forecasting further into the future at all times. And so at the same time, there's, as I said, continuous quality initiatives that go on, quality improvement initiatives that go on across our programs. We have to be careful that we don't make things so unstable or changeable that the people who are trying to carry out the programs and services can't, get a little stymied and frozen from not knowing what to deliver when. And so it's largely staff-driven in terms of quality improvement initiatives that happen as well. In terms of our FTEs, so you'll know the city has a broader vacancy monitoring process that goes on, and of course we've been part of that, and we continue those practices as we go. So we do, we've looked at those trends over time, and this is where those initiatives about permanent overcomplement hiring, extension of temporary contracts comes from. Historically, we are well within budget by year end. You'll see how close we are in the next item in the variance report based on what we know right now. And our trouble has actually been more of how do we maintain our service levels by keeping our staffing levels up. And so we have put in place that permanent overcomplement hiring so that we're there. And we still manage with, we have maternity leaves, we have people who leave from time to time. And so we manage those vacancies so that we stay within budget. And then we have these initiatives that get announced. And during the pandemic, there were a number of those sorts of things that were happening. And so we were hiring people, orienting them, getting them set up in systems, having them do work for 3 months, and then we'd have to let them go. And then we have to offboard them and say goodbye to them and do all those sorts of things, only to hire more people 2 months later where we'd have to start over with the hiring process, which takes a couple of months, and orienting them and onboarding them into systems. And it was just not a good use of anybody's time. And for the people who are working with us, it's not the kind of environment you want to stay in, right? It's sort of just show back up 3 months later. And so that's where we put in, again, several of those initiatives to do that work. At the same time, we look at evolving needs and where we need to go. And, we have a process we've followed for many years where we look at where are the pressures, where do we think we might be able to adjust to meet those. And so each year we make some divestments in some areas and investments in other areas so that we can meet the pressures that we have.
So perhaps I'll just ask a very blunt question then. In your sort of back office evaluation, is there any places that we could potentially cut in order to help with what you have identified as budget increases year over year over year? So just bluntly, is there any place that we can cut?
So as the city does, we will look at those as part of what we're putting together for you now, and in looking at what might be. As I said, we're well within that in terms of the actual budget we prepared today. We've prepared as of today. We're coming a little earlier to you than the city is, when you'll see that on the 11th. And so we're not quite as up to date with communicating it all the way through as you'll see on Thursday. But we're working to, find anything. So for example, we still had laptops left over from the pandemic that we're like, we need to get the cost for those off, that are even though we have them, mothball them, because we don't need them any further. So we shouldn't keep them connected to systems and pay for systems and licenses that we don't need. And, we're not seeing any big programs that are going to need that, so we don't need to do that. So we're doing things like that to reduce. And so we're cutting those sorts of costs. And we're constantly looking at mileage and other pieces and what are the costs there. So yeah, we're working on those pieces. And so actually we'll have built most of that in by the time that you see it, and see what the percentage is at that point.
Thanks, Councillor Huang. And now we have a speakers list. Member Kirkby, Member Danko, Councillor Tattison, and Vice Chair Joseph. Member Kirkby.
Thanks so much for the presentation. I just have a question also around just the prioritization. So when coming back in October with the budget, will we then, I know staff are working on kind of the priorities for the next year as well, just updating those. Will those come at the same time so we're able to kind of have a comparison and see that mapped out at that meeting?
Yes, absolutely. The priorities will come back. They won't be mapped out in full in terms of the action plans because those take staff a few months to develop out of those. And so there's a bit of a tweak on on existing priorities because again, longstanding issues. There'll be a bit more than that though this time in relation particularly to some of the things that we heard from the discussions as we've gone through them over the last couple of months with members around the table and just the pressures that we have. And so one of those is particularly around technology and digital needs. So spoiler alert.
Thanks. Member Danko. Sorry, we can't hear you for whatever reason. You will have to adjust your settings. I think you were able to say hello before, so. We can come back to you. How about that? Why don't you try and fiddle with it and we'll come back to you. On to Councillor Taddison.
Thank you. In your presentation, Doctor, you said that, and through the chair, modernizing digital applications and digital tools require dedicated resources. Can that funding and those resources be included or absorbed by our city IT department, where our city will be putting forth significant funding to address security and updating? Have you been looking for any of those cross-silo savings with them?
Through the chair, we're very much integrated with IT, both in the day-to-day support that they provide us for the things that we do, just having the laptop in front of me and being able to do all those kinds of things, but also with all the applications that we put forward. So we are integrated with them. They're one of the service level agreements that we have is around IT. And we have over the last several months been working with them and with all of those that we have the service level agreements with to look at, where are they going, what they need, what do we need as we move forward. And so that's been a very active conversation.
Okay.
Most of the time, I would say 95% of the time, it is City IT that is able to do that work for us.
Sure.
Some of the time it's not. For example, our electronic medical record for most of our Ontario Public Health Standard programs is not one that the city's been able to support. It's been a smaller initiative. They don't have expertise in it. And so we've had to hire outside a consultant in order to support that particular application, for example. So that's just one small area where it's not. Of course, the provincial programs and services that we use are supported by and large by the province, and our IT group is just doing that integration with our own systems piece. But yeah, very well integrated with them, very much look to each other to find the best ways to do it.
Okay, thanks for that answer. There was a comment down in the presentation, and through the chair, it said the semi-autonomous Board of Health adds operational and financial requirements. At this point, do you have a number or a ballpark guess? Are we talking hundreds of dollars, thousands of dollars, hundreds of thousands, millions? Could you just clarify that?
No, absolutely, through the chair. So, the main push of work was through the process to get through the change in governance to get, the new delegation bylaw, the procedural bylaws, all of those pieces developed and ready for this group. Sorting out who's going to do what around, how do our service level agreements need to change in response to it. So we're just about through that sort of administrative phase, and we've had as well outside legal support, as you know, to do that. So that work has been in the hundreds of thousands of dollars range in order to make that transition, but that's been time limited, and with staff turning their focus to it. In terms of the day-to-day costs, they're small. They're in the tens of thousands of dollars in terms of the supports for the new board and just working through, for example, we're still working through with clerks. Do we need to have another instance of this particular program to make sure that that eScribe, for example, is set up appropriately for both bodies? But again, that's in the thousands of dollars range. That's not.
Okay, thank you for that answer, and I understand it much better now. kind of following up with one of the questions that Councillor Wang had brought forth. And we all realize that health is probably one of the most important aspects of our budget. But if the mayor's directive said that we are only willing to, say, work within a 3% increase year over year, would that be helpful in determining priorities? And if so, what would the response of your department be?
So, we're mindful about spending, it's a single taxpayer dollar, whether it's the provincial dollars or a levy dollar, all the time. And so that's where, it's a bit challenging for us as well, because, when we look at the gross budget versus the levy budget as well, I think we're doing very well, frankly, coming in at 2.2% on the gross. As it is at the moment, it is this funding challenge that we have from a policy perspective with the other funders. But certainly understand the need and desire to do that. And so staff, as I mentioned, are already looking at like what are the opportunities, what is happening, what is there that we can do around that. And so we're already working on some options. Most will, quite frankly, be built into the budget by the time you see it. So it'll be below that current level. And then, if there's other options to be responsive to the mayor's directive that you'd need to consider, we'll work on bringing those forward. If we end up somewhere that's not expected, because either there's policy direction from the province, that November 10th timeline might not work. And so, there might need to be more thinking from a staff perspective and consideration by the board and direction from the board in order to make decisions about what approach you want to take in bringing back that budget. But I'm fairly confident we can be responsive.
Thank you.
I'll now look back to Member Danko to see if we can try again. We still can't hear you for whatever reason that might be. So I'll come back to you after the next speaker, and we'll try again. Member Joseph.
Can you hear me? Excellent. I just want to thank Dr. Richardson for the presentation. It's helpful to think about the contours of this new semi-autonomous board and the histories of thinking about revenue streams and income sources and how that fits in the budget, and sometimes cross-pollinating and sometimes not mandates. And forecasting in a way that is thinking about budget in ways that are maintaining what's possible. And it's clear in the slides that that attention was consistent throughout. You also commented on the pressures, and you raised the example of TB. And measles, these kinds of examples that show increasing demands, increasing risks, possibly a need for an increase in resources and then an increase in services provided, maybe asks. Given that you had sort of summarized that this is the cost of maintaining what we have, and the asks potentially are just to maintain, not to add additional services. And we're thinking about risks. So we also received notifications around Eastern equine encephalitis and West Nile. These things are attached to global changes and climate change. We talk about TB, you raised immigration, but we also know, for those of us that think about social determinants, that when people are in need, they're more likely to end up in criminalized situations and prisons. So highly populated areas, shelter systems, when their housing is made precarious, all of these also increase risks of TB and, as you know, weakened immune systems. These social needs will increase. They are increasing. We're watching it happen. My question there is kind of like, well, we've thought about and people are working on what we do with misinformation and disinformation around vaccination, and how we think about, the social needs in context that aren't blaming immigrants for things, but also kind of thinking about the social contours of health inequities and social determinants. all that to say, you have $64 million of like maintenance, but will there be a process where you take these risks and pressures that you've named and cost them out to say, if we wanted to do what we needed to do for the risks that are coming in, this is what it would cost, given all of what I said, you know, acknowledging that there may be a general cap on what's possible to be asked for, but also as a semi-autonomous board, we now have this structure whereby we can do our jobs in terms of acknowledging, naming, being empirically sound in what we're asking for, whether it's politically possible or not. So the question in there was, is there going to be a costing kind of risk-based or needs-based process in the budgeting process?
That's a great question, and it reminds me that I haven't acknowledged my colleagues who are sitting here as well, our directors who work on this stuff with our managers and on budgeting processes and managing risks like that every day, along with Dr. Harvey is here, and Dr. Liu, of course, is on leave at the moment. Otherwise, he would be here as well, and Dr. Shakori. And so there's a couple of things around those. So those risk-based assessments, the management staff are doing every day. And, you know, so if I take, for example, Jordan and as Director of Communicable Disease Control, when we were coming out of the pandemic and trying to figure out how could we possibly both deal with the increased number of cases and outbreaks that were happening, as well as these vaccine mandates that we didn't know how long and for what we would be able to manage them, how could we do it? I can tell you that Jordan and Jen Vickers-Manson, who's the Chief Nursing Officer, spent ages, along with others from the programs, looking at, you know, what can we do, what needs to be done, what's different, and came up with a solution that could be done within budget. And this is where it's incredible work in order to look at managing the risks and managing the financial accountabilities. But at the same time, you're quite right. We were able to do something, and our colleagues, our nursing colleagues, have been incredibly great in seeing the positives of doing this work. But it's not a solution that can cope with everything. And so ultimately, there'll come a point where we can't make any more adjustments. And so what are those risks and what needs to be done in relation to those? Those would then come forward to the board for consideration during budget time or not, because quite frankly, those sorts of issues don't come up on a nice annual basis. They come up as we have disease outbreaks or changes in trends that have gone a little bit farther, a little bit more than we were anticipating, or some new mandate that is brought down from elsewhere in terms of doing it. And so as we go through this budget, those processes have been going on and looking at, you know, what are we doing? How much more do we need? Is there a pressure? Do we need more staffing to do it? You know, how is this coping for us with these methods we put in for now? And for now, I can say that we're pretty much there. I think everybody would like a little bit more stuff, but, you know, we're able to do it as well as we can right now. The other piece is the risk assessment piece. So another report that you have in this package is our annual risk plan. And so you'll see that every year we do a formalized review of risks in 14 different categories that are uses a framework that the internal auditors from the Ontario government shared with us several years back and trained us on, and across Ontario, all public health units do this. And so every year we look at those, at the risks, what it would take to modify them and reduce them. And that includes things like costing for those sorts of things. And we generally do that work in the first part of the year so that that's done again in time for budgets. And so if we think that there's any pressures that come out of that, those are either incorporated into the budget per se, and we look to balance them in that financial analysis, or if there's a pressure that goes above and beyond that we can't address, then that comes in as well in the budget process. So there's both of those things that are going on a day, like one on a more annual planful basis, and the other day to day in terms of managing programs and services. I just turned to Jordan because he's particularly dealt with this. If he wants to add anything, or any of the other directors. Julie's, of course, dealt with this around mental health and addictions, but.
Any further questions from you, Member Joseph, at this point? Okay, looking around to make sure no one wants to talk. We'll go back to Member Danko to make sure that, and see if the audio is working.
Try this again.
It works.
Okay.
So
Yay.
sometimes the
Okay.
internet just needs a minute. So there we go. Go ahead and ask your
Okay.
questions.
Sorry about that. Thank you through the chair. I appreciate the overview and particularly the outlining of the provincial funding model, which is not keeping up with inflation or the cost of staffing, et cetera. Also, it seems that it's not accounting for population growth or increased complexity of needs in the city. But I believe that's supposed to be something that's negotiated or worked through with our agreement with the province. So do we see an opportunity, we're in the budget setting process for this year, but do we see an opportunity for the 2027 model that they're looking towards and the review to provide input, to provide feedback, because it's going to be untenable to continue to see the increases move onto the levy for taxpayers in Hamilton when we're trying to maintain reasonable tax increases locally. So I'm just curious to know what the opportunities are to raise this with the province and to see some changes that would actually allow the provincial funding to meet our needs.
Through the chair, so this process of doing the review of the funding has been one that's been a little bit more close to the chest, shall we say, on the province's part. And unlike the standards where they released a draft, as I said, in May of 2024, that we, were able to comment on, give feedback on, and, they've worked, and we hear a little bit more about that. They've worked to include that into any new drafts of the standards. This has been a little bit quieter. I mean, it was the last in time in terms of when it was planned to be done. And so, that time has also been extended as they've been moving forward. And of course, on top of that, they've had tremendous pressures from tariffs and other issues that have come to pass that affect both their time to work on things and financial issues. And so, understood that all of that's sort of weighing heavily on them as they do the process, but we don't know the process that they're going to follow. We don't know if we'll get a draft of the funding structure or funding policy that they're suggesting and have time to comment on it. I can tell you that in the past, more often we've had the opportunity to do that, but not always. Sometimes it's just, this is how things have changed. And sometimes, especially back in 2018, that happened without any notice whatsoever to a year that we were almost done in terms of what was the changes that were coming from the province in terms of municipal expectations for contributions. So that doesn't mean we don't do anything about it. Every year, generally, during the process where we send in that annual service plan and budget, we usually send a letter along with it that says, by the way, in case you hadn't noticed, here's the funding needs in order to maintain service levels. Here's what you're providing us. Here's what we're kicking in. We'd really like it if you'd kick in some more in order to also contribute to that, the needs and addressing the needs locally and really carrying out these mandates that are laid out in provincial policy documents and legislation. And we do that as well generally for each of those supplementary programs as well, if they haven't given any indication of them adding in additional dollars. We usually say, by the way, this is what it's costing you to provide the same program now. We understand you're going to fund at this level. We would like to see you fund at a higher level. This is how much we think is your share. Please get back to us and we'd love to talk. So we usually do that, with each of the funding streams as we go forward at the time of the submission of the budgets. If there's, whether there's a process for review going on or not, and then for this particular review, we're hopeful that there'll be some other way to provide input as it moves forward.
Thanks. I'm seeing you don't have any follow-up questions, Member Danko. So we'll go now to asking for a mover and seconder to receive the presentation and the report Moved by Councillor Tedison, seconded by Councillor Huang. Any further discussion on this? Not, oh yeah, sorry. Member Chung, go ahead.
Sorry, just one last quick question through the chair. I was just wondering, is there any data around, I guess, benchmarking for expenditures compared to other public health units? So is there any comparisons of like per capita expenditures for the municipality of Hamilton compared to other municipalities in Ontario?
Through the chair. Benchmarking initiatives have been something that this city, in fact, has been a leader in across the country in terms of looking at it for municipal services. Unfortunately, getting clear data on public health services with the cost-shared funding has been challenging. And so there's been multiple attempts from sort of collaborations of groups to collect the data and look at comparisons. And there is a study that's being done by the Urban Public Health Network, for example, that we're a part of to pull that together nationally. There are some initiatives that Alpha has done to try and put together some comparisons, but for one reason or another, there has been reluctance on the part of some health units to share that data that's stymied the efforts to put together the comparison groups and whatnot. Because of course, we all know Toronto has the largest population, the largest budget. We're not comparing ourselves to them, but we would be comparable to places like London, Windsor, other places. And we also wouldn't want to compare ourselves to the north. And so we need those pools to come together and have enough people in it. So we're hopeful. There's another, as I said, there's a couple of initiatives underway, again, one with Urban Public Health, and there's another one that the province is looking at that will get that data, but we don't currently have good data to do that with. We have our own, but we don't have the comparators.
Thanks very much. And so not seeing any further speakers on this topic, all those in favor of receiving the presentation and the report? Thanks, that's everybody, that carries. We're going back to our agenda right now to 7.3. Also another item for information, Board of Health 25023, Public Health Services 2025 budget variance citywide. Can I please have a mover and a seconder to put the report on the floor? Moved by Member Kirkby, seconded by Councillor Cassar. Are there any questions or discussion on this report? This, of course, details the variance for the budget. I'm not seeing any. So on that note, all those in favor of receiving by show of hands? That is everyone. It is received, and then we're on to section 8 of our agenda, which is items for consideration. So this is where there are recommendations, not just for information. For those following along, 8.1 BOH 25021, Public Health Services 2025 Organizational Risk Management Plan. May I please have a mover and seconder to put the report on the floor? Moved by Councillor Nan, seconded by Member Danko. Is there any discussion on this report? Councillor Huang.
Thank you. As I was reading through this, I wonder if you could just give us a quick overview, just so that we can have it publicly spoken about what are some of the considerations within this report.
Absolutely. So this is the risk management plan that I had mentioned earlier in response to the other question. And so this risk analysis that we do every year is based, as I mentioned, on that framework that the auditor, the ministry internal auditor provided to us some time ago, and we check in with them. It's still considered a good practice. Unfortunately, our local auditor also has worked with the province in their auditor group, and so he's familiar with that as well. And so we go through this process and look at establishing this risk prioritization. And so it looks at two things. One is, what's the likelihood that this risk is going to happen, and rates that on a scale of 1 to 5. And then what would be the impact if it happened? And you can see that red, yellow, green sort of matrix that's there in the appendix. And so those that are in the highest risk, or the red zone, so higher likelihood of happening and higher impact, were they to happen, are the ones that we report out here. And there were 3 particular risks this year that we're at that level. And so what we do with those risks is then take an action planning approach in order to reduce the risks. And we estimate what we think that risk reduction will get us to. So hopefully get it in the yellow zone at least, if not the green. And you can see for most of these, if you look at the appendix, or sorry, I should say I have to go through, make sure I'm getting the right ones. For all of these, the residual risk, we're hoping will get into that yellow zone with the action plans that are taken. So the first risk really comes back to that piece about increased demands on programs and services. And so consistent with what Member Joseph asked earlier, you can see that these issues about new and emerging priorities or even the recruitment challenges that we have in keeping people in place could prevent us from providing the programs and services that we're meant to do. And so we worked on this reallocation way of increasing staff competence, but also reallocating them to meet needs within the communicable disease area as one of those plans. And then, of course, regularly reviewing our program and financial data to see what's going on, and are we able to make any further adjustments or look at external funding opportunities. So because we keep the staff on, we're more likely to take advantage, for example, of one-time funding that we get told about in September for implementation in October. If we were told about something in September, we wouldn't be able to hire anybody till late November. Whereas by having them there, we can provide the service and get the funding from the province in order to do it. And then the Vaccine Ambassador Program was a good example where we got funding from the federal government to assist with that. So that was the first risk. The second one is about misinformation and disinformation. So this is one of the pieces where, we spend a lot of effort and, looking at ways that we can improve on our communication methodologies and leveraging partnerships with others in terms of those that are trusted by our community to get messaging out. And so we have been, again, looking at collaboration, advocacy. We've been upskilling to do this work. We've been pulling together key messages proactively so that we've got them. They've been resourced, and we're using them at those opportunities that there are, as well as doing more social media along with it. So that is something we're actively working on as well. And then the potential for redirection of priorities. And so, we've talked about the new standards coming out. And so what are these going to do? Are they going to throw us off balance in terms of what it is that we're expected to do? So far from what we've seen, no, wouldn't expect that. And so we still though wait for those to come forward and see what is there. Nonetheless, keep up to date, keep in touch with colleagues, and working with this group so that you understand it very well in terms of what it is that we do and what are expected through those changes. And then if there were to be change, working with our staff, our colleagues, to look at how to accomplish that. What do they need in order to be supported to make any changes that are needed? So all of those are anticipated to be reduced to a lower level of risk through those strategies.
Thank you. I truly appreciate that high-level overview, especially since all three risks are very top of mind. I think I'd like to go back to risk number 2, which is the misinformation. And as much as I really appreciate and understand this, I also wonder, how does cybersecurity and protection of information and data, how does that also factor in, or was that not considered a high risk at all? Because the misinformation is absolutely top of mind. It is something that we are all grappling with. And so I appreciate the plan here, but in and along those ideas of information, how are we protecting said information?
No, it's, thanks for asking that question, because it's a key piece for us as we go forward and as we work through with our IT colleagues, the piece about maintaining confidential information as confidential and ensuring we're adhering to, for example, PHIPAA around Personal Health Information Privacy Act, around making sure that all of the data that people provide to us and are trusting us to make sure is kept in confidence, it stays that way. And so at this particular point, it doesn't rise to the level of risk that we're concerned about that happening gets into the red zone. I mean, certainly that's an impact factor that would be high, but the likelihood right now with all the work that the city is doing from a cybersecurity perspective, we're satisfied that risk has been reduced. But going forward, we still want to look at ways we can continuously improve that. And so we are working with our IT colleagues around, how can we look at, for example, auditing those mechanisms for maintaining security and having public health staff do that auditing as an example. We're looking at, how can we ensure that the access controls are as tight as they possibly can. So we're always looking to improve it and get to do it in new and better ways. And as the city moves forward with its initiatives, we need to make sure we're doing lockstep because they introduce new programs. There needs to be that personal health information audit done to say, is this system, this program able to maintain the privacy and confidentiality requirements that are there under the Act and are there that all of us ethically would want to ensure are there in any case. And so those are all initiatives that we're actively working on with IT.
Thanks, and now up is Member Dako.
Thank you, and through the chair, just also focusing in on the risk category number 2, the misinformation and disinformation. Appreciating a number of the current strategies are around ensuring we're building trust and having different organizations post information on behalf of public health and making sure the information is accurate. I was wondering if, we've talked about this at this table before, if we're looking at opportunities to partner with our K-12 and our post-secondary educational organizations to build examples, to build some information into the curriculum as they're grappling with adjusting curriculum to train students to be critical consumers of information, particularly when we have AI-generated content that is not necessarily accurate. Is there an opportunity to think about partnering and helping build some information about public health information and reliable sources into curriculum, as we see those changes happening in those different organizations?
So through the chair, it's something that you and I talked about a little bit ago, and it's a very interesting idea. And it does in part have roots in a lot of the work that we do in the school program, for example, where nurses are working with teachers and the broader system, at the broader system level, to look at how do we incorporate those messages, how do we move it forward. In the Immunization School Pupils Act and the work we do with schools around that, it's about building confidence in vaccines and ensuring that we're responsive to the issues and things that arise, and looking at, we don't have huge uptake of certain vaccines like Gardasil, for example, for HPV. And so how do we work with early teens to understand that and work with their parents to understand those pieces and build that trust earlier in the system? But we're reflecting on that as well and looking at what does it mean for us. I'm just going to turn to Julie and see if, as they're considering it, is there anything more that you want to say, Julie? As you've just taken over as Director of Healthy Families and CNO and school program, but early days, but any thoughts?
Yes, certainly, and through the chair, and thank you for the question. So this is something that the school program, and particularly the school program manager, is actively thinking about, appreciating that schools do provide a really unique opportunity for some of this communication piece and really working on misinformation and disinformation. I wouldn't say at this point it's necessarily at the curriculum level per se, but it's certainly through the ongoing work that happens between the school program and the school boards. And it's certainly conversation that can be had when we think about sort of the strategic plan that is shared between public health and the school boards as well. So certainly on our radar, certainly conversations are well on way, and we'll continue to work recognizing the importance of really using schools and working with the population that attends those schools.
Thanks very much. I don't have, oh, no, I do have somebody else on the list, pardon me. Councillor Tattison.
through the chair, in determining the medical risks and disease outbreaks nationally and internationally, and considering how those risks, again, are determined, who in Hamilton Public Health has eyes on that macro health, those macro health issues like COVID, SARS, measles, or is that another level of government that informs you on that?
Through the chair, so, in these areas, it's never just one, if you will. And so we have, within the portfolios, the relevant portfolios, they're looking at those issues. And so for Jordan, for example, and our manager of infectious diseases, who is right now Chris Bickersgill, who's working on that, our associate medical officers both work in their respective areas around that. So Brendan and Bart. Bart looks more, along with Kevin, at what's happening in vector-borne disease control, like rabies, Lyme disease, all of those. So they're all keeping what my colleague used to call a watching brief on what's happening internationally and what the trends are that are going on, along with myself. And we also have an emergency management coordinator specific to public health who keeps up with colleagues. But there is, of course, a much, as you go up in those levels of government, there is a much more of, there's more resources and more impact in terms of what they have on those different areas. So provincially, we have Public Health Ontario who does that work. We also have our colleagues in the Office of the Chief Medical Officer of Health provincially who are monitoring those things. They as well have emergency management group who monitor internationally, have contacts at the national level. And then federally, the Public Health Agency of Canada has its responsibilities and includes looking internationally at issues. And there is a pan-Canadian public health network that is set up across the country, includes the chief medical officers of health from all of the provinces, and that monitors those issues and looks at what might be needed to resource them. So I'm happy to say, particularly with the changes that have happened at the provincial level with the Office of the Chief MOH, there's a lot of information flow. They're very good about sending information through to the local level, so that even though there's these levels, you get good information flow that comes across. And of course, then you've got WHO as well and others who are acting at that level. So something we watch continuously, each of us bringing the sort of local intel that we have to it, but then sharing information as much as we can.
Thanks for that answer. Good to know. The things you learn. Yeah, you know what, I'll ask offline. I would just really be curious to, have an offline discussion sometime about, how the city reacted during the COVID incident. And because, we were hearing internationally things happening in China, it was on the news and stuff. And then how did the city actually prepare for that? But I'll take that up on, offline. Thank you.
Thanks, Councillor Jadison, and that's everybody on that item. And so now we're going to go to the vote, and we'll require an electronic vote for this one. So all those we'll need a mover and seconder first, I believe, or do we have one already? Oh, we have it already. Look at that. Accomplished the job in the right order. So we're going to go to the electronic system now, and we're going to vote in favor or against the report. That vote is up.
Member Danko, if you're not logged into eScribe, I can take a thumbs up. Thank you. And Member Johnson, if you want to indicate as well. Thank you.
That carries 11-0. Next is the amendments to the outstanding business list. May I please have a mover and seconder to approve the amendments to the outstanding business list? Member Kirkby, Member Danko. Any discussion about these items? Not seeing any, we'll go to the electronic vote on this. And that vote is up. And that carries 11-0. We're now on to private and confidential. So at this point, we're approving the closed session minutes from our July 28th meeting. Can I have a mover and seconder to adopt those closed session minutes? Moved by Councillor Huang, seconded by Councillor Kassar. At this point, we're going to go right to the electronic vote for all those in favor and all those opposed. Oh, it's just a show of hands. I apologize. Sorry. Never mind electronic vote. It even says it right in front of me. So all those in favor with a show of hands. Okay, that's everybody. Thank you so much. That carries. On to the final item, which are our bylaws, just to confirm that we were here and did the things we said we did. Can I have someone who moved and second that, please? Moved by Councillor Kassar, seconded by Councillor Nan. This is an electronic vote. And that vote is up. Councillor Nan's in favor. And that carries 11-0. On that, seeing as we have no further business, this meeting is adjourned at 10:55. Enjoy your day. We'll see you next time at the Board of Health.